focused on our efforts ever since we started the organization at the White House in 1994. We have been around with our fellow National Association of Hispanic Nurses, who I know are here. I don't know if the president is here, the Hispanic nurses? Nope. Oh, maybe she was here. Nope. It's over there. Thank you very much for coming. And I know that Angie from past president, stand up and be recognized, please, for the nurses. We also work with a lot of different organizations, the Hispanic dentists, the Hispanic social workers, mental health workers, physician assistants. We have a whole list of our partners in our programs, and we give the President's Awards tomorrow night at our gala. This morning, I had wanted to have our presidents from the minority physician organizations, Dr. Doris Brown from the National Medical Association, which represents the African American physicians in the country, and Dr. Ho Tran from the National Council of Asian and Pacific Islander Physicians. But unfortunately, due to the weather, they were not able to join us. So what I want to do is just announce to all of you that we are forming an alliance, the Minority Physicians Alliance. And over the next few weeks, we will have the materials with the three organizations, as well as we're also inviting the Black Cardiologists, the Association of Black Cardiologists, to join us. We've been advocating for all of our communities for years, and we just realized that it's about time we start going after some projects together. We all have the same goals of improving the health of our communities, making sure we have more insured patients among our communities, making sure we have more prevention programs and family-centered care, patient-centered care, more quality care. And you know, we all deal with chronic stress, which is why it's so important that we start letting more of our families know that in order to decrease disease in our communities, whether it's heart disease that we talked about this morning, diabetes, cancer, HIV, all of the diseases are related to the chronic stress that our communities have. Our parents and grandparents have low levels of education. They don't encourage us and our families to go to medical school or nursing school. And we are all subject to the middle-class American life, but with that extra added stress. So I think family-centered healthcare is what we strive for, and the NHMA mission is to empower our Latino physicians to work with all of our partners, all of our sponsors here this weekend, and with our Latino medical societies, residents, and medical students to be able to improve the health of our communities. I just want to say a few words about the organization, but before I do that, I would like to have all of the board of directors, the members here from the foundation and from our NHMA, please stand up and be recognized. And they're here from all over the country. We do have board members here who met with senators and congressmen this morning from Georgia, from New York, from California, from Florida, from all over, and the local area too, the Virginia and Maryland metro area. We also have with us our major sponsors, and I just want to recognize, I'm not going to read the list, but I just want to recognize if there are any sponsors here in the audience. Could you please stand up and take a round of applause? Please. Thank you. Thank you. So lastly, I'm just going to mention a few things. We have an organization for different types of doctors. For those who are healthcare professionals, not even doctors, nurses, public health professionals, and those who are community leaders, we have our educational forums. We have 6 regional forums. We're soon to advance and expand that to cities and all over the country. We'd like to get at least 3 in every region. That's our goal over the next year or two. We have our conferences. We do summits. And this year, I want to give a special shout out to Amgen, who helped us with a series of 3 summits on cardiovascular disease in Hispanics. We wrote a report. We have the report here at our exhibit booth, and we actually presented it with a congressional briefing a month ago and talked about it this morning. We also have a scholarship program. Our foundation, the NHMA's foundation, the National Hispanic Health Foundation, started 10 years ago with a scholarship program. We work in conjunction with the Hispanic nurses who select nursing students, the Hispanic dentists select dental students, we select the medical students. We also started a public health students scholarship with the Latino Caucus of the American Public Health Association, and we started a National Hispanic Pharmacists Association a year ago with the help of CVS, Walmart, and Pharma. For those of you who are in academics, and we know we have a long way to go in medical education. We have very few researchers, very few academic leaders. But for those of you who are here, we have spent the last 2 days with the research training program, a grant from PCORI, to mentor junior faculty on the importance of Hispanic health research. We have now a cadre of 50 researchers over the last 3 years, and we're looking forward to developing an alumni research network of NHMA and our foundation. We also have been funded by the NIH, the National Institutes of Diabetes and Digestive Kidney Disease, to be able, again, to mentor residents and junior faculty very interested in learning about working at NIH or getting grants from NIH. And you'll hear more from Eliseo in a minute. For those of you who are in private practice, we run campaigns for doctors to understand how to take care of chronic diseases like our heart disease report. We also have been funded by CDC for the last 2 years to be able to discuss HIV testing and treatment in primary care practices, because we know how important HIV is, and Latinos have a lot more HIV than others. We also have been involved with CMS with transforming clinical practice for those in private practice to get access to free consultation to be able to modernize and meet the data requirements for quality care in our country. And then for all physicians and residents, we've actually been involved with the All of Us research program as a national partner with the National Institute of Health, asking our doctors to get involved in the clinical trials that are going to happen over the next decade. The goal is to have 1 million Americans in these clinical trials and have an open database for more research to be done on not only on genetics and biology, but on the social determinants of health and where we live and how we can change and have better quality care. We also have a brand new program called the NHMA Medical School Liaison Program. You know, we've all been connected at a national level with the medical students of the country, the Latino Medical Students Association. I don't know if the president made it from Texas. Oh, Eric, you're here, good. Eric and the board of directors of the Latino Medical Student Association have been partners with us. Eric sits on our board also. But we decided that we needed to actually get down to the chapter level of LMSA. They have chapters of Hispanic medical students in, I don't know, 50 medical schools maybe? 120. Oh my goodness, okay, time flies. But 120 chapters, and we're on our way to starting a liaison program, having Latino doctors from NHMA work directly with the chapters of LMSA so that we can have a better connection. And next year, I'm hoping that you'll consider having your conference, national conference at our conference. Next year, we're joining the Hispanic Dental Association and their Hispanic dental students to join us, and we hope you can help us do that for next year. And then lastly, we have a huge program from the Office of Minority Health, and I'm just going to end with this. We are very, very honored to have been recognized as an organization that can mentor high school and college kids, especially those college kids interested in not only health careers, going to medical school, nursing school, public health school, dental school, but also those who want to be researchers and go into biomedical sciences. We're looking at 200 students that we will be working with each year for 5 years, and we're recruiting them to 3 conferences. We have a conference here tomorrow with our local Virginia, Maryland, and Washington, D.C. students. We've got 150 students here. We have 40 medical schools and public health schools here in our exhibit hall to talk to them. In San Antonio, we have the University of Incarnate Word here. Thank you for being here. Provost, Barbara Aranda. And we will be working with, and I was told they already have 120 students, I guess, already lined up for Texas. And in California, we'll be working with the Drew Medical School in Los Angeles for Southern California to be able to identify more, not only Latino students, but underrepresented students. So we're very, very happy and appreciative of the support from the federal government and from our other supporters and sponsors today. So with that, I'm going to introduce our Board of Directors from the National Hispanic Health Foundation, Mark Diaz and Conchita Paz, who will introduce our federal speakers. Thank you.
Thank you very much, Dr. Rios, and thank you all for attending this conference.